Hi, my name is JaimeRobb, and I had the pleasure of working with the New Mexico Public Health Association for my field experience project. A little bit about the NMPHA. They work to impact policies in New Mexico through organization and advocacy, utilizing and focusing on their three priority policy areas of social determinants of health, environmental health and justice, and universal access to healthcare. I'm very interested in health policy personally, so my own feelings really aligned with NMPHA's work and mission. So I had two goals for this field experience. First, I wanted to learn as much as I could about the services provided by NMPHA. And second, I wanted to develop a presentation to promote Vote ER at my workplace, which is Swedish Health Services here in Seattle. So a little bit about Vote ER. This program really spoke to me as it integrates my two areas of interest, healthcare and policy. Vote ER works to implement voting registration information into healthcare spaces because voting and health are directly related. Healthcare professionals are in a unique position to promote civic engagement because patients are generally really interested and open to hearing what their physician has to say as a highly respected figure in society overall. Hospitals are a great place to promote voting because everyone needs to visit their doctor at some point. So what better place to provide information about health and then also about voting, which impacts health. And this is especially important for marginalized communities experiencing health disparities as they often have worse health. So these communities could really benefit from programs like this. Vote ER works in a couple of ways. Healthcare workers wear a badge, like the one I have on the photograph on the slide, and patients can scan that QR code and it will take them to a web page where they can register to vote and request mail-in ballots. I really loved this web page that the QR code brought up because it has the option right there to translate the page into Spanish. So it is very inclusive and helpful to patients who speak languages other than English. In the future, I would really love to see this webpage available in a multitude of languages, as I know even in Seattle here, languages like Mandarin, Chinese, Korean, Vietnamese are all very common in this area, and so I do hope that they expand their language base in the future. Vote ER also provides posters to the hospitals and the clinics, so they can be hung up around on the walls and in waiting rooms, so when patients are waiting for the doctor to come in, they can just register to vote right then. What a better way to spend your time waiting for the doctor. This is really needed at Swedish specifically for a couple of reasons. Swedish is in a prime position to incorporate Vote ER because they're already committed to investing in community health based on the social determinants of health. And the American Medical Association has officially added voting to this list. Swedish is also one of the largest hospitals in downtown Seattle, so the reach for a patient base is extensive. It can reach so many people, and it would be really helpful to all of the communities in this area, namely South Seattle, which I also discussed in my poster here, as they have high rates of low income, a very high rate of very low life expectancy. And this area is also home to the city's largest population of Black, Asian, and Latino residences. So this also goes to show that even though Washington state itself has very accessible voting laws compared to many other states in the country, there are still disparities in communities of color in Seattle, which is where residents can absolutely vote or, benefit from exposure to voting information. And Vote ER themselves is a program nationally. They've registered over 50,000 patients. So Swedish impacting this can be huge. So I also had the pleasure of working on a few other things this semester. I attended multiple committee meetings for NMPHA where I really gained a lot of information about the ways they work with the New Mexico legislature to endorse health forward policies that really fit their priority areas for public health in New Mexico. I also provided feedback on the Public Health Infrastructure Task Force list of recommendations for New Mexico's public health, and these were based on the 10 essential public health services. And then finally, I was able to complete multiple public health trainings online to get certificates, and I think having this information and this certification base will really help me moving forward in my career. I did want to thank my preceptor, Dr. Holly Mata, for being really great and supportive as I went through this process, and also Dr. Latz for helping all of us students through their field experiences. And to close, I wanted to point out that I did absolutely face some barriers in this experience. I was not successful in getting VOTE-R implemented into Swedish. I did give a presentation to a few members of upper administration, which is a great learning experience. However, they did decline to move forward with the program, but I would absolutely do this again, and I really learned the perseverance that public health professionals need to have in order to create change in such a rigid system lined with red tape. So I would absolutely do this experience again, and I learned a lot, and thank you so much.